Very good evening, everybody. Meeting again in the session of Materia Medica. And we are discussing regarding the tissue remedies, which were not included in the Allen's keynotes. So, yesterday we have finished with the Kali Muraticum. Earlier day, we have finished with the Ferrum Phosphoricum. Ferrum Phos is the remedy for the first stage of inflammation. The Kali Mur is the for second stage of inflammation. And we have discussed a minor differences in the first stage of inflammation, right from aconite, ferrum phos, belladonna, and gelsemium. And then second stage of inflammation, the Kali muraticum, the Kali sulphuricum, pulsatilla, and then the Kali sulphuricum, the Calcarea sulphuricum, the stages in which this goes on increasing. Today, we're going to learn one more tissue remedies from the Kali family. It is Kali Phosphoricum. In fact, a big backbone of our homeopathic practice is Kali Phosphoricum. Very important remedy. I will let you know why it is so important, how I used to use this remedy many times in my practice. N number of times I used to use this remedy. Because it has a wide sphere of action. There are two elements. There is Kali, potassium, and phosphorus. Kali itself have a psychotic tendency, phosphorus, the tubercular. So it is a mixed miasmatic remedy which covers all three miasms. Tubercular means sorosyphilitic and Kali means psychotic. So it is soropsychosyphilitic remedy having a very, very depth of action. And that's why I will share certain important things in which I have utilized this Kali Phosphoricum and how I used to use in day-to-day practice the Kali Phosphoricum. Most important remedy as a tranquilizer in homeopathy is Kali Phosphoricum. It is a big remedy. The way, the logic we used to use by the allopaths, that is, they used to give the tranquilizers to the patient. The end of the prescription is always the tranquilizer, Alprax in allopathy. Think in a similar manner, if mind gets relaxed, the patient recovers very fast. That is the thought behind that. In order to tranquilize mind, to make it controlled, the thoughts controlled, the irritation controlled, Kali Phos is the wonderful remedy. So any patient who is in panic, any patient who has the stress in mind, any patient who gets depressed, any patient who enters into the anxiety, any patient who goes into the anxiety relating with his health, related with his disease, think about the Kali Phosphoricum. I used to prescribe Kali Phos in biochemic doses. I'm prescribing it in 6x potency repeatedly. And once the patient is settled, better to give it at night. It is a very good remedy for such types of cases. Many times it happens that patient comes to you with a frustrated state, osteoarthritis of knees, lumbar spondylosis, cervical spondylosis, lumbar canal stenosis. Many orthopedic problems are there, rheumatism. And patient gets frustrated because of pain, because of stress, because he is not able to walk, because he is not able to perform the functions. And in such conditions, to dissolve the osteophytes, what we require is calcarea fluid. But to tranquilize the mind and to make him comfortable, Kali Phos is needed. Whenever you are treating the osteophytes and you have to make a regeneration of it, along with calcarea fluid, calcarea Phos is important. So you require calcarea fluid, you'll require calcarea Phos, you'll require Kali Phosphoricum, and if there is a severe pain because of it, you might require the Mac Phos also. And these are four important remedies in such types of cases. My prescription is always number 26, which contains all those four ingredients and which works beautifully in such types of cases. Kali Phos is the one part of the 26 number, and it helps a lot to get comfortable. The patient feels comfortable after taking that. And the first important thing is that the patient should be comfortable with you whenever you are dealing with such types of pathology. Kali Phos makes the patient comfortable for his treatment. And that's why I used to use Kali Phos off and on in my practice. So this is a remedy for all nervous complaints. It has a direct action on the nervous system, irritation of the nerves. It is a remedy from the nervous temperament. And that's why it tranquilizes the nerves. And the irritation which is caused because of the nerves or sensitivity of the nerves, the neuralgia, they gets very easily tackled with the Kali Phosphoricum. Third important thing in which I used to use this remedy is for the bedwetting. Bedwetting, generally, it has a double effect. It gives the patient a relaxed sleep. At the same time, the neurological action itself controls the bedwetting. And that's why many times I used to prescribe along with whatever may be the remedy of the patient as a constitutional. Along with that, instead of giving placebo, I used to give the Kali Phosphoricum. And Kali Phosphoricum settles the patient very early. Then I have tried it once in a case of labor. It was a delayed labor. She was admitted, the lady was admitted in our hospital one day before. And she started getting the pains, and pains were not getting settled. And her progress was very, very, very slow. It is a remedy indicated for delayed labor. So I have started giving the Kali Phosphoricum in order to get her relaxed at the same time to stimulate the process. And I have started Kali Phosphoricum 6x 1 hourly. And within span of 2-3 hours, her pains increased in a proper way and she delivered normally. So this is a wonderful remedy in delayed labor also. So these are certain entities where you can confidently prescribe Kali Phos, and Kali Phos generally I have its experience more in biochemic, not in homeopathic doses. Very occasionally I have prescribed Kali Phos 30 200 1 not beyond that. It was not required. Generally I used to prescribe it in 6x, or generally I used to prescribe it in 26 or 17, in both the number 17 and 26 having the Kali Phosphoricum, as well as 24, which is 5 phos, or 16 is also 5 phos. Those I used to use. There also Kali Phos is there, and Kali Phos makes a very good results in such types of cases. So this is a clinical aspect, clinical story which I have discussed with you. Let us see, open your Borix Materia Medica, and what he says in first paragraph matters a lot in understanding the Kali Phos. So open your books, Kali Phosphoricum, and just see phosphate of potassium. One of the greatest nerve remedies. First sentence defines the site of action. One of the greatest nerve remedies. See, very important. This is my suggestion to all of you when you are reading the Borix Materia Medica. The first sentence, always concentrate on it. If you make a habit of reading these remedies in such a manner, then you'll never forget. Then immediately, whenever patient comes, it stuck to your mind. If you open, I have not opened the book, just see Natrum Sulph. What is the first sentence? Just open and check. A liver remedy. Is it there? Open your books and see Natrum Sulphuricum, first sentence. A liver remedy. That itself suggests that natrum sulph is dealing with the liver problems very specifically. It's a liver remedy. Is it there? It is starting of the remedy. Open the
Yes, sir.
palladium, an ovarian remedy. See, palladium, first sentence, an ovarian remedy. Whole center of action of it is on the ovaries. Understand that. That is more important to grasp the remedy. An ovarian remedy. So once you grasp those things, then it becomes rather simple to think about the remedy. Then you are able to catch the depth of the remedy. Then easily you can prescribe. When such pathologies are there, polycystic ovarian disease, ovarian cyst, the palladium plays a very vital role. That's why we have to understand each sentence, and that sentence should go in your mind. Kali Phosphoricum, first sentence matters a lot. What he says, one of the greatest nerve remedies, prostration. Prostration of nervous system, exhaustion. Patient doesn't have strength to go somewhere immediately. If you ask, he looks, is it necessary to do it immediately? This is the reaction of the patient. The nervous prostration is the word for the Kali Phosphoricum. Because it is painful, because it is because of pain, it becomes lame, weak and tired. That tiredness, weakness is the result of this exhausted nervous system. And that's why it is a wonderful remedy in orthopedic cases or neuroorthopedic cases. Spinal canal stenosis causing neuropathy. So lumbar disc prolapse causing indentation of the nerves, one of the important remedies. Or um, lumbar spondylosis causing indentation of nerves, Kali Phosphoricum is the remedy. You have to think in such a manner, correlate the pathologies with the symptomatology of the remedy, and then you will grasp the depth of the remedy. What is says further? Marked disturbance of sympathetic nervous system. Very important. What the sympathetic nervous system do? There are two systems, sympathetic and parasympathetic nervous system. Marked disturbance of sympathetic nervous system. And that's why there are a lot of problems, lot of sensory problems, lot of motor problems, lot of problems which just now I have told you one bedwetting in issue. I used to use the logic when I prescribe. I used to use the logic. I correlate what Boric says and what is the pathology. What he wants to explain and what is there in the disease. If you are able to catch all those things, then you are good practitioner. Then you are a good clinician. And one should be a good clinician in order to be a better prescriber. Conditions arising from want of nerve power. So there is want of nerve power, means nerve power is missing, less more nerve power. Neuroasthenia. Asthenia means exhaustion. Kashacha asthenia? Neuro, nervous systems. So it is the asthenia of nervous system, weakness, exhaustion of nervous system. Mental and physical depression. Mental depression, physical depression, both things. They are not so active, they are dull, they don't want to do anything. All those things are quite common with them. So this is what you have to think. Mental and physical depression are wonderfully improved by this remedy. And this is the truth. I have verified it n number of times in my practice. And that's why I confidently says about the Kali Phosphoricum, because I used to use it in daily practice. The causes are usually excitement. First cause is excitement. They are very excitable. And so because of excitement, the problems happens to be there with Kali Phos. Excitement, even happy event causes the problem, the sad event causes the problem. In both, the patient is more excitable. Overwork, elements from excitement, elements from overwork. That is another important thing. These are the persons who are excitable, excited, enthusiastic, at the same time do a lot of mental work basically, and then they gets exhausted. And lastly, the worries. It is an anxious remedy, very, very much anxious. There are varieties of worries and with those patients. So, if you feel that patient is anxious, patient is restless, patient is irritable, patient is in a hasty, hurried mood. And if you want to stop all those things, then better remedy to give him is Kali Phos 6 in repeated doses, and you'll see the results. Start using the Kali Phos in your practice. You'll see the very good results with the homeopathy, with the Kali Phos. Besides, it corresponds to the states of adynemia and decay, gangrenous conditions. So, see the depth of action, decay, gangrene. These are the entities which happens in the syphilitic miasm. So, remedy is having widespread. The soro-psycho-syphilitic, all three miasms are covered under the Kali Phosphoricum. Wonderful remedy for such type of destruction. In these two directions, it has won many clinical laurels. Remember, it is in the treatment of suspected malignant tumors. Yes, this is also one of the things. That's why it works. Malignancy, where the hard tumors are there, I used to use the 26 because calcarea fluid covers the hardness, the Kali Phos covers the suspected malignancy as well as it tranquilizes the things. So, along with calcarea fluid, Kali Phos plays very vital role in such types of malignant tumors, suspected malignant tumors. After, see, the last two sentences, three sentences are having a pathological correlation. After removal of cancer, when in healing process, skin is drawn tight over the wound. So, person is operated for tumor and patient wound is healing and the skin gets contracted. Kali Phosphoricum, wonderful remedy to be considered. And it has that depth to cover the cancer cells, to work for cancer. And last, that's what I have shared with you, the delayed labor. It is a very good remedy to stimulate the delayed labor. So this paragraph itself gives you whole idea what Kali Phos is there. Now we will going to read first the mind and then only the few important particulars. Mind is important because this has direct action on mind. Anxiety, nervous, dread, lethargy. That's what we have discussed. Lethargy is indolence, slowness, dullness, activity becomes very less. Indisposition to meet people. So they avoids meeting the people. Extreme lassitude and depression. Extreme lassitude, tremendously exhausted mentally, lassitude, and there is a depression. Very nervous, starts easily. Very nervous means very, very sensitive. The word is very sensitive. Nervous comes at the tip of their nerves. They are very sensitive. Someone says something, they get immediately hurt. Starts easily, starts tachakna. Irritable, yes, irritability because they are nervous, very sensitive. Brain fag, one of the important remedy for the exam going students. Mentally they are exhausted and to control their exhaustion, brain fag, this is wonderful remedy to be utilized. I used to give this or either 5-phos. Hysteria, night terrors. So those who used to never get sleep at night properly and they feel the terror at night, Kali Phos tranquilizes them. Somnambulism, that is what is somnambulous. Yes, these are the people who have that habit of walking in the sleep, somnambulism. Loss of memory, slightest labor seems a heavy task. So you ask them to do certain, give them a certain task, even though it is so small, they immediately gets disturbed. No, how can I do? I don't feel I can do it. This is Kali Phos tendency. Great despondency about business. They are always talks in a negative sense about the business. They becomes absolutely sad. Despondent means sad, nirash. Shyness, disinclined to converse. They are always shy, and that's why they never wants to converse, never wants to get communicated, and they remains aloof. That is the Kali Phos. See, Kali Phos is the person who is not like a phosphorus. There is more impact of Kali on that Phos, because of which he is reserved. He never wants to get mixed. He never wants to say anything to anyone. He is not able to communicate as the phosphorus communicates. So Kali's impact is much more, and because of which the things are restricted in Kali Phosphoricum at mental level. Then head, there is one symptom, cerebral anemia. It is less blood supplied to the brain, ischemia, leading towards the degeneration of the brain, leading towards the exhaustion of the nervous system. That's what you get. And one more feature followed by it is headache of students and those of worn out by fatigue. So it is one of the important symptoms for the headaches of the student. We have discussed Calcarea Phos is one of the important remedy for headache school going girls. Headache is there. Natramur we have discussed. It is also a remedy for that. Kali Phos is a very good remedy if it is because of stress, it works. Headache relieved by gentle motion, that is the modality. Then eyes, there is a drooping of eyelids, that is very important, like causticum. Ears, humming and buzzing in the ears, like Kalimur, yesterday we have discussed. This is one more remedy. Nose, there is fetid offensive discharge. Face, right side and neuralgia relieved by cold application. There is a right-sided neuralgia of the face, better by cold application. Mouth, breath, offensive, fetid, excessively dry in the morning. Gums are spongy and receding, like capsicum, hemamelis, lachesis. Throat is gangrenous, sore throat, and paralysis of vocal cords. Stomach, you get a nervous gone sensation at the pit of stomach, like ignatia, like sepia, like sulfur, like anacardium. Feels seasick with nausea. Diarrhea, in abdominal complaints, putrid diarrhea, then followed by depression and exhaustion. Then one more thing, it is cholera stools like appearance of rice water like veratrum, arsenic and jatropha. Prolapsus recti like podophyllum or ignatia. This is one more remedy. Female menses too late, too scanty. Feeble and effectual labor pains. Underline that. And this is good remedy to stimulate the labor pains. Male, there are nocturnal emissions with sexual power decrease. Urinary organs, very yellow urine, on incontinence, see, enuresis. This is the feature. It is nervous system feature. I used to take into consideration then. Respiratory asthma, least food aggravates. Short of breath on going upstairs, cough with yellow expectoration. Extremities paralytic, lameness in the back and extremities, exertion aggravates. Pains with depression and subsequent exhaustion. Fever, subnormal temperature. Temperature is not increased in Kali Phos, subnormal temperature. This remedy, modalities, general modalities are very important. Worse by excitement, worse by worry, worse by mental and physical exhaustion, worse by eating cold and early morning, and better by warmth and rest nourishments. So this remedy is a wonderful remedy specifically for worn out constitutions where nervous system is worn out, weakened, exhausted. This remedy plays very, very, very vital role. It is a wonderful remedy. Just go through the remedy relationship. He has compared it with Kali hypophosphaticum, debility with wasting of muscular tissue, phosphaturia with general anemia and leukocythemia, effects of excessive tea drinking, chronic bronchitis where the expectoration is thick and fetid, sometimes scanty and tough. So, there are many remedies he has compared, those remedies which are not fully proved. have a pathological action over there. These remedies you must read, you must know, but I always say caution in using those remedies because they are not fully proved. Another remedy which is mentioned over there is Zenista. It is diarseweed, contains scopolamine, frontal headache and vertigo, worse motion, better in open air eating. Dry throat awakes with water brush, itching eruptions on elbows, knees, ankles, promotes diuresis in dropsical condition. Then one more remedy, again unknown remedy, macrozymia spiralis. Extreme debility after severe illness, collapse, weariness from no assignable cause, no pains, boring pain at the vertex, vomiting and retching all night, impossible to open the eyes, giddiness and cold. Gincum, Gelsemium, Simicifuga, Lachesis, muriatic acid, these one should compare. So these are remedies which one must compare. And lastly, the dose, the 3rd to 12th trituration, the highest potency seems to be indicated in certain cases. And that's really the thing. Yes, I used to use very occasionally Kali Phos, 1M Kali Phos, even 230. But generally, I used to use it in 6 potency. So Kali Phos remedy for mental and physical exhaustion, debility, nervous prostration, neuralgias, good tranquilizer, brain fag, any stress in the pre-malignant conditions or suspicious malignant condition. Even for the when the skin gets withdrawn after the removal of the cancerous tumor, Kali Phos plays very vital role. So one must know the depth of Kali Phos. It covers all 3 miasms, the sauropsychosyphilitic, and that's why it has wide use in homeopathy. So my suggestion to all of you, go through this remedy and learn it by heart. Learn it from 12 tissue salts mentioned in the playlist of biochemic remedies. There is playlist, I think it is a role of biochemic remedies, like that playlist is there. Go through that and read this remedy over there from the 12 tissue salts and you will get in-depth action of this remedy over there. So that's all for today. If any query is there, we'll have a chat. Otherwise, we'll conclude. Anemia should be treated properly. Anemia, you have to ask either proper diet. Patient should consume maximum green vegetables, jaggery, then apples. I used to tell one thing that I have shared with you. Mm, that is wet juice, wet leaf juice. That is very important. Wet leaf juice is a very important entity which increases or covers the anemia
What,
very.
sir? What wet lip juice? What?
Huh?
Wet lip juice. What you told?
Wet गेहूं रहता गेहूं. It is a cereal. We
Huh?
used to make a chapati roti from it. That
Wet
is a,
lip.
yes, that is a wet. So only for 8 days, if you put the wet over there on the soil and put water over there, and within 8 days, you will get the leaves over there, leaves very small, thin. Cut that and make a juice. It contains more amount of chlorophyll, and it is a very, very important for the
Okay,
treating the
okay, okay,
anemia.
okay, okay, okay.
There is one question, sir, in Kalimur, there is one rubric, paralysis pain from. What does it mean? Paralysis pain from means pain is so severe character that patient is unable to lift that. That is the paralysis pain from. It is secondary to pain. It is not a complete paralysis, it is paralytic feeling. Patient is not able to lift that. That is paralysis pain from. For example, a patient is having a vascular necrosis and there is a lot of marrow edema. And if you ask the patient to lift the leg, he is not able to. That is paralysis pain from. Kalimur is the remedy which covers that marrow edema. So that's all for today. Thank you. We'll meet directly on Monday. Good night.
Thank you, sir.